What's open? What's closed? Can you shop? Go to restaurants? Get your hair and nails done? How about schools? You could be forgiven for being a little confused about COVID regulations when they seemingly change from day to day.
Everything that should be up is up. Everything that should be down is down.
There needs to be open, honest transparency with the data that the governor is using and his team in order to make these decisions.
People are tasked with making up their own minds what they feel is safe and how they'll cope with changing rules. And making matters even worse, we hear that the virus itself is changing from month to month and place to place. How can anyone possibly figure this all out? We talk with some experts who can help. Fox 11 News In Depth starts right now. Hello, everyone. I'm Hal Eisner. So many changes in such a short period of time. If you're confused, you're not alone. Some of the biggest changes recently have to do with vaccines. In fact, just days ago, a change came down from the governor of California, changing the vaccine distribution rules. The new recommendation will prioritize age rather than occupation, and that could result in more people over the age of 50 being vaccinated. Our first guest is Dr. Anthony Harris. He's the medical director of Workcare. That's a company that we use here at Fox 11 at KTTV to help vet employees' health before they come to work, before I come to work. He's also very familiar with the COVID-19 virus. So, Dr. Harris, let's start off talking about some of these virus mutations. What have we heard about that?
Sure. Well, first, Hal, thanks for having me on, and happy to jump into talking about those mutations that we've been seeing from day one of COVID pandemic in Wuhan, China. Two strains started out with the S and the N strain, one being more virulent, S strain, and the N strain being more communicable. And we've seen that play out over and over with multiple mutations. They're called clades at this point in time. A clade is just a family of mutations that we've been tracking. And so what we've seen play out in Florida and California with the new strains that have emerged is nothing new under the sun, particularly. We've seen a mutation to the S or the spike protein, which is how the virus gets in the body in the first place. And those mutations thus far haven't proven to be as such to make the vaccines that we've seen ineffective. So to put it another way, the vaccine should protect us from these new strains. And so we'll continue to watch it. We'll continue to see the virulence of these and the communicability of these new strains, but there's no panic alarm yet. And the data that we're seeing from the numbers, even though we're seeing a surge in California, hopefully it doesn't spell out across the country.
Now, just to be clear, because you were getting a little in the weeds there. So the coronavirus is a spiked protein. It's got these little spikes on it. We've seen that for months. Mm-hmm. Those little spikes serve as a key into your human cell. And then that protein suddenly starts to subdivide or metastasize through the human cell. It's not really doing much before it gets into the human cell. Is that when we start to see some variance, some changing in what's going on to that protein?
You got it. You nailed it, actually. So the virus itself gets into our nasal passages. It populates in the mucosal cells, which line our nasal passages, and it binds to the ACE receptor. And that's where that spike protein for the virus itself comes in handy, right? It gets into our cell. It causes our cell to replicate the virus itself. So our own human mechanics for how we create new proteins actually creates new viral particles. And that's when we see the number of viral particles go up and we start to shed those viral particles. And so you nailed it. The spike protein is key in how that virus gets into our cells and causes us to eventually be infected with COVID-19.
And what these vaccines that we have right now do is they block the protein spike from getting inside of the human cell, right? So the new vaccine plan now emphasizes age over employment. First of all, is that a good idea?
Sure. And to be specific, the antibodies that we make do, in fact, block that spike protein, right? And what we found in the data regarding age is that there are greater risks for those higher in age, right? We're talking 50, 65, and that inflection point is important to the new recommendations. We see that there's a disproportionate shift of illness in populations such as African Americans and Hispanics at a younger age. So instead of 75, older recommendations of how to distribute the vaccine. The younger we go, the more we're going to capture and protect those in those vulnerable demographics. And I think you'll see that continue to play out across the country in terms of decreasing the age and prioritizing that over some of the other risk factors, such as occupation.
I say this somewhat lightly, but certainly as seriously as it is. And that's it. This is the gift that keeps on giving. The longer this pandemic goes, the more we're seeing unexpected long-term effects. Now, I understand that one of the things you've been seeing is a big effect on mental health, including psychosis. Is that right?
Mm-hmm. You're right. And we're just still at the tip of the iceberg in terms of the mental health effects from this pandemic, right? We're not talking just the physiologic effects, meaning I contract COVID and I recover, but I still have what's called COVID brain or fogginess that can persist. We call those individuals long haulers who experience symptoms for many months after their recovery. But the repercussions on those who weren't even infected with COVID from a mental health standpoint is dramatic, right? WHO some time ago called it the second pandemic in regards to the mental health effects that this pandemic from strong social distancing restrictions have had on the general public. And we'll see that continue to play out well into 2021 and 2022.
Well, what are some of the other long-lasting effects you've seen with regard to COVID-19?
Sure. We are looking at health effects on the lungs, right? In terms of those who have had persistent cough, 1 out of 5 people will experience prolonged symptoms for 28 days after their onset and recovery from COVID-19 and may test positive for a prolonged period of time. We're seeing microvascular disease from COVID-19, those who experience stroke as a result of the coagulopathy, meaning your blood cells clump together as a result of your infection from COVID-19, and they can block vessels important to perfuse your brain, causing a stroke. We're seeing this in even something that is lesser talked about, erectile dysfunction, as a result of COVID-19 infection. So there's a myriad of unintended consequences that people don't think about from avoiding vaccination or avoiding becoming immune. And so we want to talk about that more so for sure.
You know, Dr. Harris, I always say that I learn something new every day. Coagulopathy. How do you say that?
Coagulopathy. Yeah. It just means your cells are all confused and clumped together.
And that's a new thing I just learned today. Dr. Harris, thanks so much for joining us. We'll have you back again. Best to you. Thank you so much.
Awesome.
Coming up next, thank you. Coming up next on Fox 11 News in Depth, we talked to a county supervisor about all the changes in rules and regulations we're starting to see, how that's playing out on the local level. We'll be right back. Welcome back to Fox 11 News in Depth. I'm Hal Eisner. For months now, we've been on a roller coaster ride when it comes to regulations concerning the coronavirus. From partial shutdowns to a hardcore stay-at-home order to curfews, we've had it all. And local governments try to juggle the challenges of following orders from the state, from local health departments, and doing what's best for their citizens. Joining us now is San Bernardino County Board of Supervisors Chairman Kurt Hackman. And Kurt, first of all, thanks for joining us. I appreciate this very much. Can you walk us through where San Bernardino is right now as far as COVID regulations and your COVID situation?
Well, thankfully, our numbers are tracking down. Our infection rate and those who have the virus the numbers are going down. So with the governor releasing the stay-at-home order for Southern California, really, or the state, we're back in the purple tier. And we're very hopeful that within a week or two, we get possibly to the red tier. But purple tier means what we've been used to for a long time before the complete shutdown of restaurants eating outdoors and limitations on those who go in different stores.
And to be clear, the purple tier does have some strict restrictions in it. It's not like they opened the door and said, come on in. So, when you look at that, you and I talked the other day after the governor made this announcement. But, just to caution people, if this thing gets bad again, you have another surge, you could end up with another stay-at-home order, right?
Correct. The governor's basically calling all the shots from Sacramento for us and the local government. So we have to respond to what those health orders are. And so we're very much repeating the message that we're all sick of hearing of wearing your mask, social distancing, and washing our hands. But we know that our actions as residents have consequences for the rest of our neighbors and friends and frankly, the county. If we take those precautions, we don't have those big group gatherings at home, we can open up more and more of our economy, which is desperately needed here in San Bernardino County and the rest of Southern California at this point.
Yeah, it's interesting because these restaurant owners have had a really tough time of dealing with all of this. It's like one told me the other day, it's like a yo-yo. You're open, you're closed, you're open, you're closed. Now, what do you hear from your constituents and what do you hear from your restaurant owners?
The simple word is frustration on all levels. They're very frustrated with the change of the rules. I mean, business people are very flexible. If you make pragmatic rules, they can work within. Sometimes those rules from the state of California come down so strict that they're forced to either shut down or violate the rules, which they're not used to doing. So it makes it in very difficult positions. When we went from, spread out within doors, they made arrangements within their restaurants to have tables 6 feet apart. Then all of a sudden the rules change. Now you have to eat outdoors. So they go out and buy tents and heaters and outdoor equipment, and then they shut down. And so then you let your staff go, then you bring it back on, you reopen, now we're shut back down again, reopen again. And it's frustrating to them. And that's what we hear most of it, is the frustration from both the business owners and the workers.
Yeah, but I got to believe it's also frustrating for you. I mean, look, I think you and I can probably agree, this whole pandemic episode over the last year is a work in progress. For people like you and people in the state, you're all learning, right?
Correct. We're taking steps, and I like the premise the governor took at the very beginning is let's work on the data and science. Unfortunately, California being California, then some politics come involved. And, we have disagreed with the governor on many of the policy choices, and we have, petitioned and wrote letters and actually sued the state of California a little bit to debate some of those policy calls. Not every place is the same in California. San Bernardino County itself is the largest geographical county in the United States. It's different from the Big Bear Mountains to the high desert to our valley area. And we should have some of those abilities to fix things on the local level, but that hasn't been the option for us here on any local government. It's been basically one size fit all for the state of California.
I got to ask you, though, I mean, actions have consequences, right? So San Bernardino County spent, nearly $76,000 in a lawsuit that failed, seeking to annul stay-at-home orders issued by the governor. That's $80,000 you lost. And so, how much of an impact is something like that, where you go after something to change it and then you lose?
The money is always unfortunate, but if you think about how much our businesses are losing on a day-to-day basis, how much our income for the employees that get laid off from such orders, and the ultimate tax income for the county and the local cities, it's been really tough on us to make sure that we're trying to keep government open. And government's here as a safety net when things get bad, and things are bad now. And so obviously our work goes up in times of need, not down. And so those need for resources on law levels, 80,000 is really a drop in the bucket compared to what we're costing a handful of businesses after 2 months of shutdown.
Talk about what you anticipate over the next few weeks. Oftentimes what we hear is that projections are made looking ahead to 4 weeks and what they believe that the numbers are going to look like. What are you thinking you're going to have here in about 4 weeks in San Bernardino County?
We're very cautiously optimistic that we may get to the red tier within those 4 weeks. Our ICU numbers, we have some bed space finally after a time where we didn't have it. And our infection rates are going down, our testing results, but also so is our testing. And that's another thing that the local government has to worry about is every time we feel like we're making benchmarks as far as the number of tests per 100,000 or 1,000 people, those type of things for the state, they merge them all together by the county. So those numbers change every 2-3 weeks too. So sometimes we get real close to that edge of red tier, then the rules change, and then we're back in deep purple. So, but the biggest bottom line is we need to keep people healthy. We need to get them back to work, and we need to stop the spread of this horrible virus. And by following the basics that we've all been saying this whole time, hopefully we could do that.
Well, hopefully. And there's still time ahead because this virus hasn't gone away, still in the purple tier, still dealing with some restrictions. And so the bottom line is you're doing what you're doing. It's a work in progress, right?
Absolutely. And, we got through the month of December of lots of social gatherings, lots of family gatherings where we saw the spread. Hopefully don't have too many of those events coming forward. We do have Super Bowl, so we're going to warn people to don't do those big group events like you normally do for Super Bowl. We don't want to see another spike up after that weekend 2 weeks later.
Well, you're the first to bring that up to me. Thanks for doing that, and thanks for being with us on Fox 11 News in Depth. Really appreciate it, Supervisor. Thanks so much.
It's always a pleasure. Thank you, Hal.
All right, take care. Coming up next on Fox 11 News in Depth, county health departments also negotiating the maze of this pandemic. What can we learn about what might be coming next? We'll be right back. Welcome back to Fox 11 News in Depth. Every county here in Southern California is handling this pandemic differently. We get updates from the LA County Health Department on a regular basis. Let's get an update right now from Ventura County and find out what's going on in this county. Joining us now, Rigoberto Vargas, the Ventura County Public Health Director. And, we talked the other day, Rigoberto, about the changes that the governor was offering up. And we also found out the other day that there is a COVID-19 variant in the county. And I'd like to know a little bit more about that. Can you tell us about that variant?
Yeah, so one of our initial tests that involved wastewater testing in the greater Oxnard area has detected a variant of the coronavirus. So we're looking further into it. We also have samples into the state to confirm that finding.
When you have a variant like that, and I don't know, I think these things are all different, but does that mean the transmission can be a little faster, a little easier for this protein?
Yeah, that's one of the biggest worries is that these variants are higher in transmissibility, and so they could be more faster spreading in the community. So that's one worry.
Dr. Levin is your medical officer there in Ventura County. He didn't think this was very surprising. He also said it was a tiny amount. But, even a tiny amount can be a big concern. And tell us a little more about finding this in the wastewater. Was this in the Oxnard area? Is that what I recall?
Project is testing wastewater in the greater Oxnard area. So that's currently where we've confirmed that it's been found.
Why were you testing the wastewater in the Oxnard area?
That's just a project by city leaders and some of our statewide elected leaders that got some funding along with other sectors and philanthropists to have this pilot project, and it's centered in the Oxnard area.
I guess the reason I'm asking is because we think of transmission being from person to person within a few feet. We think about it being transmitted through the air. I never really thought about it showing up in wastewater.
Yeah, of course, that's where it's detected. It's not, of course, where it's being transmitted, but having a variant indicates that the virus may be out there being transmitted in the community and could, cause some issues down the line.
A lot of the consternation going on in every county, really, is how to deal with the vaccinations. And when you and I talked before, we talked about the fact that there's not a lot of supply, not the kind of supply you need to be able to handle all the tier ones, the 65s and over, all the things that you've got front loaded into your tier system. How is that vaccination going for your county? And what are the downsides? What are the upsides?
Yeah, no, well, there's definitely a lot of upside with the vaccine. We need to get to herd immunity when we immunize approximately at least 70% of the Ventura County residents. We're far from that, and we're far from that because of the limited quantity of vaccine, as you mentioned. And so as soon as we get the vaccine, we get it out the door into people's arms. And so right now, because of the limited quantity, we've started in terms of age grouping the 75-year and older.
Okay. But, the thing is that the stuff doesn't magically appear. So you're having to deal with tier 1A and what's slightly under that. How far behind do you think your county is from the other counties?
Well, I don't know how we would term it in terms of behind. Each county is different, unique in terms of its demographics and quantity of vaccine proportionally that we're getting. Each county has its own leeway in terms of, for us, we want to make appointments within a week out, and that's the quantity that we have. And so we don't want to make announcements that we're, for example, vaccinating 65-year-olds and then have appointments 2 or 3 months out.
All right, we have less than a minute, but let me ask you, is the state's new change in vaccination strategy going to affect the county's plans?
Well, we're awaiting further clarification on the apparent age-based recommendation for the counties to do their prioritization. We'll be in alignment with that, but then there's also always leeway at the county level based on our demographics. So we're just in alignment when it comes to getting the vaccine out as soon as possible to as many people as possible.
I've got to ask you, we only have 30 seconds left. How is this job for you? I mean, I know you health directors have more weight on your shoulders than you ever bargained for. How are you dealing with this? How frustrating can this all be for you? Again, we only have a half minute.
Oh, thank you for that question. I really appreciate it. To all the county family and leadership within the county, statewide, nationwide. This is definitely a worldwide pandemic. And so we're just going on adrenaline and excitement about developments, but it has been taxing, on everybody. It's been difficult.
Well, thank you so much. It's like we said earlier in the show, it's really kind of a work in progress. So thanks for joining us, Rigoberto Vargas, the Public Health Director for the County of Ventura, and we'll be right back on the other side of the break. Don't go away. Welcome back. And if you haven't already, please check out my podcast. It's called What the Hell, and it's available wherever you subscribe to your podcast, or you can just go to whatthehellpodcast.com and download it. Well, that's it for this week's Fox 11 News in Depth. Thanks for joining us, and have a great week, everybody. As we leave you, we remember a Los Angeles icon who left us a year ago. Here's some moments from our coverage of Kobe Bryant. And if the narrator sounds familiar, it should. That's Morgan Freeman. Bye-bye, everybody.
Long run out by Kobe Bryant. Oh! What did I just see?
He took us to new heights.
How good is this kid?
The city of angels on the wings of one Kobe Bean Bryant. For 20 years, the heart and soul of the Lakers and Lakers Nation.
You can't write something better than this.
But his biggest achievements may have been off the court. Husband, father. Today we remember his life, his legacy, his impact on Los Angeles. And we remember all the victims of that tragic helicopter crash.